Okay. So I picked a topic for today because I thought it was pretty interesting. I'm just gonna mute everybody here, and then we'll get people to jump in. I read this thing online about the head of the NCAA saying that, hey, there's probably no way that we can avoid having a pandemic outbreak as part of NCAA sports. If we go back, there's going to be an outbreak. And, I didn't really understand, like, is that saying like we shouldn't open up, or we're going to open up and what the heck we're going to do this? But I certainly thought it was interesting that was, something that he would say. And I wanted to get everybody's opinion on, okay, well, it looks like we're heading back. I've obviously talked to a number of programs, and they're always giving me dates like, okay, we're going to go back mid-June, and then it's mid-July, and now it's August or whatever it is. So everybody's kind of bumping it back, but they are figuring they're going to come back. And then I saw another article about, oh, how much money are we going to lose? There was an article about BYU and how much revenue they're going to lose if they don't have sports, and what they have to cut back on, and do they have to fire people. So certainly everybody's thinking about this, and everybody's thinking like we have to go back in order. And Rob Panarello and I've talked about this just in terms of the economic impact. So I'll get Rob to start, and then we'll jump around, and I want to get everybody's opinion on, should we be going back? 1, 2, how do you handle it? And 3, what if there are positive tests, people getting sick, and worse, people dying? Rob, like, think of the pressure to go back in terms of the financial piece.
Yeah, I mean,
so they are going to go back like everything else.
They're going to go back. It's just, when's it feasible to go back? Because you have to figure, right? The stock market's down, so their dowries are down, right? And then with people holding on to their money because of the economic situation, what's going on with donating, they're not holding classes. You're making profit on room and board where there is no room and board, because everything is through, computer now, right? Home study. So they're losing a lot of revenue based on either what they can generate or what they have invested. So they're gonna have to do something at some point in time, because when, profitability and expense, those two lines cross, you're out of business, whether it's an educational institution, a private entity, or whatever it may be. So they're going to have to go into business sometime. Meaning they're going to have to play it sometime. And so, what does the financial runway look like that enables you to prolong this period of time so that, you don't go, quote unquote, out of business, for lack of a better term? I think when they do go back to play, whenever that is, if we don't have a cure, never mind a vaccine, but even a cure, right? Because if you get something and you can cure it, people are less hesitant to, or less anxious when they get that disease or that sickness. If someone gets it, look, you've had people in the NBA get it already, you have people in the NFL get it, and that's just daily living of life. What are you going to do? You're going to put these teams together. It's inevitable somebody's going to get it, whether it's from the locker room staff bringing in from the outside, or are you going to quarantine these people that they can't even go home? They have the 24/7. They're not allowed to go out. Like, how do you prevent anything? And when someone gets it, what do you do? Is that team now not participating in conference play or league play? Or because how many people have they spread it to? Because obviously it's a young population. How many people have they spread it to that are actually carriers but non-symptomatic? So, your mind could go forever on this thing. When they get it, do they have particular facilities that they're going to be treated in, or they're allowed to go back to their own dorm and just quarantine in their room? I mean, this whole thing is obviously an experience that no one has gone through before. So yes, I can't give you a date, but they're going to have to, at some period of time, resume play, even if it's not in front of an audience, because they have, at least in the Power 5 conferences, they have TV revenue, right? And then once they do return to play, yeah, I think people are going to get this virus. They're getting it now. You're not going to be in a bubble that you're going to be prohibited from getting this thing. So
yeah, because we had talked about even the flu. I think there was a case, last season or whatever, where a team had a number of players who had the flu, so they flew them on separate flights so they wouldn't infect. You know, even if this was a case where the coronavirus didn't kill people and it just made them really sick, it would still be an issue in terms of fielding a team and
Yeah,
having practices, right?
absolutely. And you put them on two separate flights, they're still landing at the same airport. So, you know, I don't know. I don't know. It's interesting.
Yeah. Keenan, what are your thoughts on this? Because, you know, obviously you have some contact with swimmers who are in collegiate programs, but also even your own group of swimmers and people coming back and the potential to get sick. And do you just keep running things?
Yeah, well, like you, I wondered the intent of that comment by the head of the NC2A. It's like in a country that's, or in a world that's, it's scared. Like, do we want the voice of, there should be a reasoning to instill like panic, right? So I wonder the intent or who a speechwriter is, but I think we think that about a lot of people that speak in our world and country right now. But I agree with Rob in terms of, we need to get back. One of the things that I'm really hoping happens is we change the narrative and being so concerned about, baseball occurs from February to October. Like, if we can, this country, this world is like thirsty for sports, right? So if we just change the normal season for 1 year, I don't think anybody would have a problem with it. If hockey all of a sudden is playing in August or what have you, like if we can get them back. And I think to try and reel it back in, not to get off too big of the topic, but from the NC2A perspective, I think there's some things that they can look at strategically that will allow sports and athletes to get back. I think we can accept the fact that it's going to be really, really hard for Division I universities, but at all divisions, to bring the general student population back. And so for one time, in a very, very long time, like NC2A institutions may look like just housing grounds for athletes, because we don't want to risk international athletes or even athletes or general student populations from our hotbeds like New York City, Los Angeles, San Francisco coming back to the University of Oklahoma and spreading it like wildfire. So I think we can accept that, and that's just going to be the norm for the year, where it may just be athletes back on campus. And a second aspect they're going to have to look at is not pigeonholing every sport into one. I get that football makes the money, and I love football more than anybody. But how they open up is going to look extremely different than, say, cross country. Probably like the first sport that can open up is cross country, right? Like you get your team of 12 and you just run in 12 different directions for a long period of time and then come back, right? Like they can open up, they can get going right now. But just as basketball, and I think like the NC2A is getting really, really lucky with a lot of the professional sports opening up. So they're going to see they need to crack a couple eggs to make an omelet. We're going to see the like successes and the shortcomings of opening up by those organizations, and they'll be able to do it. But I guess to end, the one thing that all athletic directors and presidents or regents are going to have to look at is the lawsuit world we live in, right? So
good point.
Mom and dad let Johnny or Susie come back because basketball's limiting it to 12 athletes, and they've got 6 hoops, so it's 2 athletes per hoop, and they can stay 6 feet apart. But they just accidentally caught one from the fencing team. The fencing team is a team that had Outbreak. They're not going to sue the fencing team. They're going to sue the university or the institution. And so sadly, that might be the big determinant. But I think, the message is pretty clear, like the 3 T's, right? We need to be able to test, and I think we're getting there in terms of availability. And again, are they still like testing positive after 3 weeks and with symptoms, things like this that we have to work out, of course. Tracking, which is going to be super, super important. And I think in our country, right, you're going to have one side of the story that's going to worry about the big brother syndrome of like, you're knowing exactly what I'm doing. Well, yeah, because we don't want this thing to spread. That's kind of the issue. And then treatment, and as Rob said, right now it doesn't look like we'll have a cure, but at some point in time we'll have a vaccine. I don't know when that's going to be, but that's really the only treatment. So if we can handle the first 2 of the 3 T's, then I think we'll be in a good situation.
Yeah, that testing piece is obviously critical. And I think it's difficult when, the leader of the country is saying, well, sometimes you need a test, sometimes you don't need a test. Do you think, whose responsibility is that? Is that going to be the university? Is that going to be the state? How is that going to get done?
Yeah, personally, I've gone back and forth on this and glad that I only have to collect and aggregate the information from the medical side and then provide it to the decision makers within the organization, because we're all aware that one of the assumed reasons why this thing spread so quickly is because of the lack of testing. And so as we start to discuss and hear a flattening of the curve globally and nationally, we're like, okay, we can open up and we can start testing the top 1 percentile of health in the world, right? Professional athletes. Like I remember, like, wasn't it like 3 days after like the pandemic and New York started to go crazy? Like Kevin Durant comes out and is like, yeah, I got tested, and it's like, who, like, just Kevin, like, stay in your room. Like, why are you taking a test from people that are dying left and right? So I always think back to that, because I wouldn't want it to be on my conscience where, again, we have a shortage and we're testing athletes that may be asymptomatic or not susceptible. Where the funding of that comes from, I don't know. That's for whoever's got a great business and political science background as well as sports could answer better than I on this, because it seems like it can be a everybody wins scenario, right? Like, I don't know, like the companies that manufacture the test, they got to get paid. Maybe that's where the money, yeah, I think it could be a win-win situation. I just don't know what it looks like.
Yeah, because I would figure I don't know how much a test costs, but I'd be like $50. Okay, yeah, I'll pay for it. I just want to know. But yeah, it'll be interesting to see, one, how it gets paid, and then even just how it's implemented, like logistically. I mean, how many student athletes you got? 500 student athletes plus all the staff plus. So hopefully that's part of it, rather than just saying, hey, let's go back and see who falls over. Like,
I think we're past that. I don't know. I think Dr. Fauci is like conquered that train of thought. Like, I think, but
okay.
Wait till 6 o'clock tonight, right?
every evening's a new one. Robert from St. John's, I wanted you to jump in, and I want to go around and talk to some of the people working at schools. You don't have to give it all the information that you're getting from your administrators, but certainly just your opinion on how this is going to look, Robert.
Hi. Hey, hi everyone. Yeah, I agree with the previous guys. I mean, financially, we're going to be kind of forced to get back to the competition, and I also think psychologically, people fed up and they just want to get back to some normalcy, and I don't know if that's going to force us back too soon. But we're planning, on, different phases of when we're going to come back. They're looking at, our first phase would be sometime in July when men's and women's basketball could come back. And then the next wave would be the fall sports, soccer and volleyball come back in August, planning on how are you going to clean and sanitize? How are you going to social distance? How am I going to do that in the weight room? And I'm giving them ideas, but I think, it's impossible. It's impossible once all the teams get back. How do I get, all our teams, 200 plus athletes through a weight room that's 3,000 square feet? There's not enough hours in the day. Even if I go outdoors, I asked one of our doctors, I said, all right, we're outdoors. I'm conditioning our athletes. They're ventilating more. Does that 6 feet social distancing then now be 12 feet? So if it's 12 feet, I have to spread out on a soccer field. I'm only going to get really half of the lacrosse team because guys have to have their own lanes to run. So I think it's just almost impossible. And then even if you do all of this, these athletes, when they get back, they're not socially distancing when they get back. They're going out to the bar. They're going out to their dorms. They're hanging out. When they play their sport, how do you social distance from your sport? I was just watching the Bundesliga today. These guys are right next to each other. And I know they probably isolated and whatnot, but it's just very frustrating. And the one person or people that are, I think, being overlooked are the strength coaches. I'm going to see more people in one day than anyone in athletics. So my exposure rate goes through the roof. And if people around me aren't wearing masks, even if I am, I'm potentially at risk, according to one of our doctors. So that's kind of like, for me mentally, do I really want to go back?
Yeah, and even your
my concern.
ability to, if you're that contact person, maybe you're transferring it from team to team and you don't
Right.
know it.
Exactly. Exactly. So, how do you wear a mask and exercise? I mean, I think physically you can, but once that mask gets saturated, I've heard that it's not as effective. So, it's just we very uncertain time. And I think all this planning, yes, it's necessary, but I think it's all fluff, because I don't think it's possible. You either have to not go back or go back and accept that there's going to be exposure and potential outbreak. And then maybe there's another shutdown for even longer, unless, like Keenan said, we're talking about testing, and they do come up with effective tests that, or I heard that right now they're giving a lot of false positives. So until they get an effective test that could screen people more, I guess you're going to have to accept that people are going to get sick.
Do you think that there's value in going through this process of, like, even from what Keenan said, managing mental health and expectations? Like, we're going back, we're opening up, knowing that, like you said, you can't protect everybody, and then there's going to be a second wave, but at least we tried to open up and we go back, you know what I mean? Do you think from an optical point of view, we still have to do this and have the masks, and from liability show that we did due diligence around trying to protect people?
I think you do.
Yeah.
I really think you do, or you just never go back until it's cured, and I don't think that's going to happen. I think people are going to want to get back and want to get back to, athletes want to compete, and it's hard to hold them back. And my other concern was, St. John's is represented by 43 different countries in athletics. What happens to those athletes, those volleyball players? I would say about 80% of our team are international.
Wow.
What if, they get back and now they got to quarantine for 14 days? Majority of our men's soccer team are international students. So, that's a concern of mine, that, can you field a team? If you don't have those athletes, and then what if someone does get sick? What happens? They told us that if someone gets tests positive, that they're not going to have to just totally shut down. They'll quarantine that individual, and I don't know what's the process after that is. And that I'm nervous personally as a strength coach, because I'm going to be exposed. I'm in a weight room in the basement that has no fresh air. And, am I going to feel confident that I won't get exposed, or, like you said, expose someone else, or bring it home to my family?
Yep.
Where now you see that there's some connection with younger kids. I have a 10-year-old. Do I want to bring something home to him? That's a concern of mine as well.
Yeah. Yeah. And you're not a spring chicken either, right?
No, I'm not. I'm definitely not. But you know what? I don't know if this is going to sound sad, but this is what I do. I don't know anything else. I've been doing this for 20 years, and I've been blessed to be at St. John's for that long, and and this is all I do, and I want to get back. My wife even said if I had the option of going back, and I was relatively, if I was younger, and I would go back in a heartbeat. No mask, get in a weight room, and let's go. But that's not going to happen too soon.
Yeah. Thanks for that, Robert.
Oh, you're welcome. Thank you.
Adam Parsons, I wanted you to jump in as well. And you're a little bit of a younger generation than Robert, so I want to get your interpretation of what's going on and what may be happening at your school. And, like even Robert brought up some good things about, okay, say we can do some isolation as coaches on the field or in the weight room. Like in Vancouver, there's a restaurant that's installing plexiglass on every table. So now you have basically a penalty box for every table. And that's like a growth industry, like plexiglass installation, right? The spit shield. But what if an athlete goes back to the dorm and has to go to a cafeteria? How do you control that? Like, what are you guys thinking, Adam?
And that's a really good question, Derek. And luckily, I'm at Colorado State University right now, and I think the university is doing a really good job of kind of taking input from every single area as far as what we need to do to open safely. So one thing you brought up specifically were cafeterias. And I think even, when they do plan on opening in the fall, and they just officially announced that, our president did a few days ago, and I don't know how they're going to figure it out logistically. Unfortunately, that's going to be a dining services problem, but I don't think they're going to have a lot of seating available in their cafeterias. And if they do, it's probably going to be not as available. Things are going to be more spread out, so they're not going to be able to accommodate as many people in person. So they're going to expand the grab and go options. And I think that's going to be a really important thing for most college campuses moving forward, is kind of retooling those departments to be able to have more of that available to kids, especially student athletes. The last guy that spoke, I'm sorry, I can't remember his name, I apologize, did a great job of expressing a lot of the concerns that are on the mind of a lot of college strength coaches across the country, whether, especially with the scheduling piece of it, and just for our own personal safety. And even though I'm a little younger, I'm 32 years old, it's not something I'm interested in contracting, even though I'm not in as much of an at-risk group, because you get a lot of news reports that are coming out with talking about some of these secondary complications that are coming to light. They talk about young people experiencing or having strokes shortly after having the coronavirus. And even though, when they experienced it and they were hospitalized, they were able to overcome it. But then shortly after that, it seems like there's a lot of other secondary complications that arise from it that young people aren't immune to. So I'm definitely concerned about that as well. We have a couple hundred student athletes that, if we're opening and we have everybody fall on campus, we're going to be running a lot of kids through on the hour, taking 10 to 15 minutes between every group to sanitize everything for another wave. And so it's going to be long days. It's going to be a lot of stress. And so those are definitely all concerns, and I definitely share those. The other piece that I would add, and obviously this is kind of small potatoes because it seems like a lot of the larger issues have already been put on the table. The challenges that we're going to face are keeping student athletes engaged. I know Keenan was talking about how, some colleges and universities may be more training grounds than anything. There might not be competitions. It might just, we may spend a year kind of in, being housed at our facilities, training our athletes, and they don't get to go out to compete. And for a lot of them, that's going to be a really big struggle mentally to stay motivated to push. I work with track and field, especially, and, with a lot of my groups, but especially the sprinters I work with, if there isn't a competitive element to what they're doing, it's very, very hard for them to be interested and engaged in what's going on. So that's something that I'm already kind of racking my brain and thinking about what I need to do to keep them mentally motivated to continue to train hard, even though there may not be kind of a light at the end of the tunnel with that. And I think this is already brought up. The other thing I'm interested in is, it seemed like the threshold for things shutting down was very, very narrow. It was very short. A couple NBA players contracted it. NBA season shut down the whole rest of the year. And so I think a big question that now needs to get asked is, what is the threshold for how many people need to contract this in your organization or your league before you decide that you have to shut down again? That's something I'm really interested in seeing moving forward as we try to reopen again.
That's a good point, because I don't think there was any science behind that NBA shutdown, but that was probably one of the first catalysts for everybody else to go, oh, the NBA shut down, right? Like that was a very interesting point in time when they decided, no, we're not going to do this. And then everybody else followed suit. So that could be considered some sort of leadership, but was there any scientific basis behind it?
Yeah, and I think this is going to become a really big game of chicken and a real big game of monkey see, monkey do, where you might, you're sometimes you're afraid to be the first person or the first organization to make a decision to move forward due to a media backlash or something like that. But then do you also want to be the last person where maybe you're putting your organization at a competitive disadvantage, whether it's economically or in the product you're putting out on the field?
Yeah, that's a good point. And maybe there's like a Madonna effect where like, oh, a celebrity did it, so like we should do that. You know, it's bizarre how people actually operate. Robert brought up a good point too, just in the chat. Has any university, and I'll open it up, but I'm going to go to Ben Hoffman next. Thanks, Adam. Has any university actually outlined like, hey, we've got this many masks, we've got this much PPE, protective equipment, and this is how we're going to use it? Like, are they scrambling right now to build up an inventory? Ben, did you want to jump on? I don't know if that's been discussed, but certainly it's an interesting question around how are we going to protect our staff first and foremost, you know, medical staff, strength and conditioning staff, coaching staff, let alone is everybody going to practice with an N95 mask on? Or, you know, what do you think, Ben?
Yeah, I know we're looking into ordering a bunch of PPE. One of our athletic trainers been put in charge of that, because you know, a lot of our planning has been when we do get back, what's training look like, how do we structure weight rooms, I'm sure as everybody has, and things of that nature. So if we're coaching on the floor, we're gonna have to be, you know, like decked out in everything that we can. I think they've been saying gloves when cleaning, not necessary for like just coaching, but definitely we have to wear masks and things of that nature. And it's interesting from a PPE standpoint, that's about all I've heard. I know that we're supposedly only going to open up if we can have tests in place. I'm not sure how they're going about that. The university is going to be looking into that through the health center or something like that. But I've also heard, you know, I think Arizona said they're planning on going back and kind of manufacturing tests through their medical school or whatever they're doing, and maybe Ohio State as well. So trying to do everything in-house. And I really just don't see us opening if we don't. I think the PPE thing can be hopefully solved relatively easily if the supply chain works and we can order it and it gets here. But testing, it's like, can we develop that? Can we have the volume? And then if you have, you know, all campus back, like how can you even manage that with the whole athlete population and everybody else? And kind of that's my big concern is it just seems like a bunch of volume. And then how do you kind of organize that? If like some of you guys said, like I think Keenan mentioned, if it's just athletes, then that could be a little bit easier to kind of manage all those things with just staff and athletes and things of that nature. But I don't know. It's pretty crazy, pretty scary either way.
As far as you're seeing right now, is there is our individual universities, and just from your own experience, trying to go, okay, what can we do in a self-contained, you know, situation? Like what can we do as a university to address all these things and not relying on, say, the state or the federal government? Or do you think that's what's going to happen? Like even if the government has to say, here's some money, spend it however you need to make sure things are safer?
Yeah, I think on our end, that side won't be hard. I think the university will put the resources where they need to make those safety issues. Now, obviously, we're a pretty big state school. I think on the government side of things, where we're going to run into problems is like each county is opening up at different rates now in the state of Maryland. So PG County, where the school is one of the like highly hit areas in the state. So they're opening up now, and PG County is still like spiking the other direction. So I don't think like optically Maryland could start to open up if that's still going on, you know? So I think they'll control that side of things, but I know athletically we're already starting to buy some of the PPE and get a testing protocol and choice. Once those openings happen, I think we can start at least the process, but I don't really know what the whole process is going to be.
Yeah, no, I'm sure it's like everything, it's all in discussion, and nobody's going to pull the trigger quite yet as to what exactly they're going to do. But certainly I'm curious if the NCAA is going to come out with some sort of policy guideline or statement around like, this is what we would expect as an NCAA school, that you handle this, and this, and these are our priorities.
Yeah, I think also it gets hairy when certain schools are opening up, say in a conference, and then other ones aren't. And I'm not sure if like the Big Ten has said anything about it. They might have. Like if one school can't open, what do the other ones do, and how does that even do things? And obviously getting on campus and training might be different than actual competition. That's a whole nother conversation. But it's interesting for sure.
Yeah. Thank you, Ben. Mike Hurst, you wanted to jump in and add a comment, given your NCAA experience. Just kidding. It was a joke. Mike's in Australia. Mike?
Yeah, hi everybody. Hear me all right?
Gotcha.
Derek, you got me okay.
Yeah.
I don't want to be the boy that shouted the sky is falling, all right? But just a couple of thoughts. That aircraft carrier, the American aircraft carrier that's anchored somewhere in the Philippines or somewhere, they've been reporting that a number of their sailors who tested positive have tested again positive second time round some weeks later, recovered and then got it again. So that's alarming, I would have thought.
Do you know if they were symptomatic on the second one?
I don't know anything more than what I just saw a brief on it. The other thing about training with a mask on, and again, I don't want to sound alarmist, and this is just a one-off thing, but I saw some images of a cyclist who trained with the mask on, and they showed x-rays of him with a collapsed lung. And they said that's down to training hard with the mask on. So where that leads us is, I don't know, it's not nice. And the other thing was, I've had a real low-grade kind of upper respiratory infection for bloody months. So I decided to go along to see the GP a few days ago, 3 or 4 days, 2 days ago. And he said, "Oh, have you had a C19 test?" So I went along. He said, "I'll organise it for you." I said, "Okay, good." It was the most uncomfortable thing I think I've ever experienced. I thought the guy he rammed that rod so far up my nose, I thought he was looking for brain tissue.
And I assume you've had a prostate exam too, right? So.
Yeah, this was nothing like that. This was 100 times worse. But then, okay, so I'm clear, everything's good. However, I could catch it today. So, if I mix with the wrong people, which I'm not going to, but how many times do you have to get tested? It's just an endless cycle of test and retest. The other thing about the cost of tests, in Australia, we have a very strong social medicine support system, and my test cost me nothing. That's all I had to say. Just a few thoughts.
Wow, I don't want to get tested after hearing that.
Oh, man, I tell you what, it was nasty. Sorry.
I wanted to get Bob Alejo on. He joined us late here, but Bob, basically what we've tried to cover was what's happening at the university level in terms of the planning going around return to sport and some of the responsibility of the university to make sure that everybody's safe or manage risk, I guess, because it's very hard to make sure everybody's safe. But have you had discussions around that? Have you heard what other schools are doing or what the NCAA is saying, particularly after that statement from the head of the NCAA saying, we can't avoid people getting infected?
Well, you get so many people that just don't realize what they say is impactful, even though they have no idea what they're saying and how they mention it. I mean, that's, you got to understand, just like in our business, when you talk about evidence, you got to start saying things like likely, perhaps, all this, to say, it said kids are going to get, sick. Well, so, okay, let's think about that. I was talking to Ted Labernidis the other day, and he was telling me that, you got to remember when that NBA, that last game the NBA played and what's his name was found positive, right? He played in that game against the other team. Nobody on that other team has tested positive. So is it likely they could get infected? Well, sure. But are they definitely going to get infected? Well, obviously not. So, I mean, those are the kind of scary things you got to stay away from, which we tried to do that right off the bat. Using terms like outbreak is fine, but, chaos, catastrophe, words like that. You just got to be careful about using those sort of terms. In our case, yeah, I mean, I had my staff start creating a document about 3 weeks ago. We have now finished that document. It's going to the Emergency Operations Committee, and then it'll eventually get to the president by the end of the week. But in our setup, Derek, the director of student health, Dr. Linda Kastiakis, she's going to be reliant upon the health and welfare of 30,000 students. So, she's very learned, very smart, knows what she needs to do. And I trust her. I mean, she does a great job. So you got to have, it's not so much a return back to play. It's return to campus. It's return to locker room. It's return to training room. It's return to administration building. It's return to the basketball court. It's return to all that. And then it stops there. And then it goes to, and here's our idea when somebody from our team tests positive in practice. Here's what happens when somebody tests positive in competition with no spectators, competition with spectators. I mean, it's not a small document, and it's also something clearly that you shouldn't wait until they say, okay, guys and girls, in 3 weeks, we're going to start up. Oh, okay, let's have a meeting and figure out how we're going to do that. That's also too late, right? So in terms of the NC2A, I think it's funny that Mark Emmert came out earlier and said, if students aren't coming to campus, then athletes are definitely not coming back to campus. Well, 2 weeks later, recants that, saying we're going to leave it up to the universities and campuses to figure out how they want to do it. It's so then on top of that, you add the several definitions of essential and safe, and then you say, okay, now what, right? I mean, so in our case, I'll just say in our case, in California, we start with the governor, right? And then you have the CSU's chancellor, the California State University chancellor over all 28 universities. And then you have the president of each school.
When you get a chance, bring on my phone.
So that makes a great deal of difference about how you figure out how you're going to do it. And we certainly can't go against our president. And how we go against the chancellor is different. Even the chancellor, who mentioned that some classes will be online in the fall. He never said all the classes. And so in that statement, it also didn't say no athletics. So now we're in a position where, okay, so now we're waiting for more clarity. And so I think part of it is it's good when making a document that you leave it open to some interpretation. But as the guy from the WHO said about 2 months ago, if you're waiting for the right time and the perfect intervention, you're going to have major problems. You've got to make a decision. You've got to put a stake in the ground and say, we're doing this right now. Doesn't mean you can't change it, right? And I think he was talking about in terms of, I'm not sure what it was, HIV, maybe it was SARS, I'm not sure, but he just said, quick and swift action is necessary. So that's kind of where I think what's happening. I mean, the questions that we've had together as senior staff are unanswerable, many of them, much like our document, you're actually guessing at what you might want to do. I said, we should probably start with how we started initially, distancing, limited numbers, plenty, and all that, and work backwards. I think that's the thing that's probably most important. Stage 4 or 5, when we have spectators and everybody's on campus, I'm assuming if that's the case, probably not wearing masks out on the field. I think if they're spectators, that's going to be, we've probably come to a place where people are comfortable and all that. So, but I thought our first idea, what's going to happen if we say we come back? Now, that be in mind, Ted also told me this. He was talking to somebody who was working at University of Cincinnati, where they have a medical center. So you're also got to have to look at some of these schools that say they're taking what we would consider aggressive stances with campus and athletes coming back. If they have a medical center, that makes it easier for them to do that. In fact, there's some that are using them in a cooperative study. But there was a good point being made to Ted from him or her, I can't remember now, that said, we want our athletes back first. We want them back before the students because it's a limited number. We can follow and track all of them because they'll be under, our purview, and they're a healthy population. So let's say, for instance, you have an outbreak with this healthy population, then you know for sure what's next, right? And I thought that was an interesting strategy, but it kind of made a little bit of sense, right?
Yeah, is there an argument, Bob, to say, like, we need to do this experiment? We need to see what a limited, return back to normalcy, and is it acceptable to say, like, we bring our students back, everybody goes online for school, but we still bring the students back, we have them practice, train. That's phase one, and then if that looks good, then we have them compete with other schools rather than jumping too quickly back into that and not being able to control those environments as much. Do you think that's acceptable? Like, even like as a general student saying, well, how come the athletes get to go back, but we have to do on, do you think that's still acceptable in terms of a model coming back?
Again, there's so much hypothetical nature to this that I can't even answer that, honestly. Because you just don't know. The other thing too, Derek, is when athletes come back, it may be necessary to turn that voluntary, right?
Yeah, like, are their parents going to be going, I'm not sending my kid back?
I think there will be, just like they would the kid who's an English major, that's just a student. I think there's, so that's the conundrum you come into. Okay, we're open campus. No, classes are live. Okay, what about the one kid in your class that doesn't want to come but's enrolled and paid tuition? Well, you're gonna have an online class then. You can't just demand that they be there. So now this thing starts to vibrate out a little bit. It's same with when we come back at whatever point it was, perhaps that's voluntary, and yeah, somebody's parent may say, I don't want my child outside. I don't. So there's lots of things to consider. Number of tests. Can you do it every day? And the NCAA talks an awful lot about leveling the playing field, which is bullshit anyway. But at the same point, what about all those schools that can afford to test kids every day and schools that cannot? So now it's okay, we can't test, we shouldn't come back. So we're at a competitive disadvantage for no other reason than perhaps not us, but that school may be at a disadvantage because they can't afford it. So I mean, it's going to come down to some really hard decisions, and some of those decisions are deemed difficult because your other schools in the conference or other schools in your state or other schools are doing something different than you, and it's going to be hard to figure out where these intentions are coming from. I mean, much like, look, I'm not political at all, but it's much like the comments you hear from governors and the president and potential candidates. Like, where's their motivation coming from talking about certain things? Is it all about, the science? It's hard to realize because you have so many places to go to hear this information.
Yeah, no, it's exceptionally complicated. Fred, you had some comments in the chat there. I wanted to get you to jump on and give us your thoughts.
Yeah, absolutely. A big thing with us that we're doing is it's going to be education over fear. So when we do bring our athletes back, it's educating them on what to be doing, what not to be doing. They're 17 to 24 in some cases on some of our teams. They're going to do what they want to do. It's the same thing I think someone put in the chat. Kids have no perspective of it, so we have to educate as best we can. And then I'll just jot down notes of everything. It's absolutely a psychological thing for the athletes to be back in some way, shape, or form. You're taking right now their identity's been taken away of who they are and what they've been doing. So getting them back, I think, is something good for them. And I put in the chats, athletics can absolutely be a pilot for what the rest of campus is going to do. Just, we were talking about briefly before, limited number, easier to control. They have a goal in mind of playing. That needs to be their playing, going back to school and getting to normal. That needs to be their driving force, our driving force as well. But getting them meals instead of doing cafeteria, setting up something with a in our area, Meyer or Kroger, and doing a pickup and ordering for food, getting an idea of that. I'm just some of the notes I've jotted down through all this, and then something we've been going through with our team.
And you're at Eastern Michigan?
Yes, sir.
Yeah. How is it just generally in that area of the country? What's the thought process?
With us being that close to Detroit, we're a little bit of a hot spot. Wayne State is right downtown in Detroit, and then obviously U of M is right up the road from us. So there's 3 universities plus Concordia. That's a NAIA that's all packed tightly in this area. So really getting people to kind of, hey, don't socialize, don't be around others, it can be tough. But I mean, we have athletes that are here already that have moved into their apartments that they're going to be in for the year. So, using them as, hey, you've been through a 2-week quarantine already, getting them in early, or being one of the first ones to get tested, get cleared, and get ready to go. Just speaking with them, they're willing to kind of do anything just to get back.
Yeah. So you were saying, like, you think this is a like Bob said, a legitimate way to kind of run a test or an experiment because they are in a very low risk group.
It's terrible to think that. It is terrible to think that to run a test with, with people's lives, but it is one way to kind of get things going.
Yeah.
And I
interesting.
missed Detroit Mercy. I missed Detroit Mercy. I apologize.
Well, thank you very much, Fred, for that. Adam, you had a follow up, and then we're going to go to Carmen.
Yeah, some of the things that Coach Alejo were discussing kind of hit home with me, and it seems like one thing he was discussing was really not waiting around for the NCAA to make a decision. I know it was something that was mentioned earlier about you're going to come out with specific guidelines for how you're going to run a weight room or how you're going to run a practice. And, historically, I just wanted to point out that, the NCAA sometimes almost intentionally likes to be ambiguous with some of these things. I'll point out some of the controversy regarding strength coach certifications. I know that both the NSCA and the CSCCA were pushing very hard for the NCAA to take a stance on that and making their certifications the required official certifications to be a strength coach at a member institution. And it seemed like that was going to happen. And then kind of at the 11th hour, it was pulled away. And a lot of the language of those regulations was walked back. And, that was all around the same time that you had those issues with Rhabdo at some of those other schools. The other thing I'll point out is recently the NCAA put out some of their phases. There's no specific guidelines, but some of their phases related to coming back from COVID, and it literally almost looks like a copy and paste of what was posted on the White House website for guidelines. You just switched a few things like athletics, athletes, maybe weight room, and so it's exactly in step with what the White House is posting. There's probably good reason for that, but again, in some situations, it seems like the NCAA won't take a hard stance. And maybe some of the older coaches here can fill me in on that. But whenever I've discussed this with people, it seems like, well, if we take a hard stance on something and our member institution doesn't follow through on it and somebody gets hurt or killed or gets sick or something, I don't know if there's a concern that they're also liable in some type of lawsuit as well. Maybe somebody else can kind of fill me in on that and clarify.
Oh, that's a huge can of worms. But yeah, good point there. Let's get the lawyers involved. We don't have any lawyers on the call. I should get one. I should have like a resident zoomPOP lawyer. But yeah. I'll get to Carmen, but Rob, can you jump in quickly? Like in terms of that, like one of the fellows in Vancouver was telling me that the College of Physical Therapy has put out very vague guidelines, like we recommend that you wear appropriate PPE, but it's not N95, it's not this, it's not that, so is that on purpose?
Yeah, I think you have very vague situations at times because you're putting yourself out there. If you make a statement that of absolute, right? Just like governors of states are saying, we're going to let the schools decide on their own when they're going to do things. You know, those things have been mentioned. You know, sometimes things are kept at arm's length on purpose. You know, there's brought up before, you know, at the beginning of this zoomPOP. I would be very surprised if there's not instances of litigation. I do. And I think part of the problem is going to be, look, you know, we're a hotbed here in New York, right? And I will tell you from my own perspective, speaking for myself, when restaurants open, I am not going to be the first online. So, you know, the psychological aspect, I get it. There are athletes foaming at the mouth to get back to practice and playing, but you can't tell me there's not going to be athletes who are committed to the team on scholarship who are going to have hesitation to go back either. I mean, everybody's their own individual, right? So it's going to be interesting. It's going to be interesting. And then everybody's going to be jumping in with 2 feet. I can assure you that.
Yeah, no, that's a very good point. Yeah, no, I was thinking I'm going to post a poll question for everyone and see what everybody says. Carmen, you've worked in NCAA at Hawaii, and you've worked in different institutions in Canada. What's your interpretation of all of this, and what do you think is going to happen in Canada versus the, say, the NCAA, where in Canadian universities, there's not a lot of revenue being generated, if at all, with schools. So are they going to take a different approach and keep the shutdown longer because there's not this economic pressure per se?
Well, from what I've heard is like at the University of Toronto, they're one of the schools that's actually planning on having classes on campus in the fall. There was a meeting with coaching staffs just earlier this week, but the lecture halls, let's say if they hold 100 people, they're only going to allow like 36 people to be in attendance. So obviously, well, and I should also say the University of Toronto is very much a international school. And so there's already the concern that a lot of them aren't going to come back because of the situation. And so the attendance is going to be a lot less anyway. But like I said, a lot of the Canadian schools are just planning on doing online classes for the fall. But like Toronto, they are planning on going ahead with at least some of the classes with smaller sizes. The big concern, though, was athletics. That there was no commitment as to whether or not athletics is going to be able to come back. And the reason is because of just the cost factor of the added cleanliness of the facilities that's going to be required. And where the money comes from to pay for the janitors and all that extra cleaning that's going to be required is comes from tuition. So if the tuition is low, then they don't know where the money's going to come from to pay for all the extra cleaning. So they cannot make a commitment at this point as to whether or not there's even going to be athletics because of that. So it's a wait and see situation. But at the University of Hawaii, that's a different situation. Well, it's the same in that it's very international. The majority of the students that go there are from like all parts of the world. The problem is it's a small campus and the majority of the people live in the dorms. So even if the athletic department thinks that, oh yeah, we can keep our athletes, you know, safe with all the, you know, safety precautions and whatnot, they might not get the virus at practice, but when they go back to the dorms because of the congestion of people. So there's no way the athletic department can stop that. Or just the variety of people in Hawaii, like all the tourists coming to Waikiki. I mean, it's just such a well, what would you call it?
Clusterfuck?
A pot. Oh, there we go. I really don't see how they feel that they can just go full steam ahead and no one's going to get sick and we can do it, especially because also they the schools or the teams either play in the Mountain West Conference or the Big West Conference, and the majority of those schools are in California. And it's like, well, if they're not going to be playing sports, you know, who's Hawaii going to play against? They'll just be, you know, practice, 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 if they can even go ahead and do it. So I think they've haven't taken this situation too seriously and somehow feel that they're immune from it because of their location and that, oh yeah, that we've got, you know, the best air in the world and blah, blah, blah. But I don't know. I think there's going to be a big problem with them actually being able to compete or you know, prevent student athletes from getting sick just because of the dorm situation. And like I said, just the variety of people from around the world that come to Waikiki. So I think both situations don't look good.
Yeah, it's very, very difficult and complex, and even the poll that I just had you guys participate in, even if there is a vaccine, like, is everybody going to get it right away, or are some people going to be like, I don't know, we'll see if that creates some sort of side effect, or is it, because it sounds like to me that at least the federal government in the U.S. is like, we want this vaccine right away, and we'll get it out, and we'll run trials, and we'll produce it before it is actually approved, and then we have a whole bunch to let everybody use. So that makes me kind of go, okay, let's let some other people take it first. Almost like this, like we were talking with Fred, like is this a little mini experiment around, well, let's see some other schools do it first, or other states do it first, and then make our decision based on what that result is. Does anybody have any comments on that?
I'll say, you just got to look at every state as they go.
I'm going to mute Bob there for a second until he recovers.
Yeah, you just look at each state as it goes. Florida, Georgia, even parts of Indiana, are up and rolling in certain counties, which is crazy. So it's a little bit of both, of just kind of seeing how they do. Yeah, I think someone said they're in a Maryland area working with small groups now, and just seeing how that works, spacing out. Friends of mine in Ohio are just going to be able to start on the 26th here. So it's going to be really interesting to see how all that kind of works out.
Yeah. Seeing these little pockets and see like, oh, okay, the curve has kind of stayed flat. Maybe that'll be good to see that. I don't know what to expect. We'll get Bob back on. Sorry, Bob.
Look, when we first started out, we were talking about, hey, let's talk to these other schools. Let's find out what they're doing and so-and-so doing and how they're reacting. And my first thought was, what makes you think they're listening to the right people? I mean, that's just because they're, Michigan or Florida State means they're smarter than us. I mean, I don't know that that's the case. So I'm more curious what everybody else is doing, but I'm not overly driven by what other campuses are doing. I mean, if you look at how they're promoting it and how they're very careful, like, so for example, Andy Fee at Cal State Fullerton said something to the point like, after the chancellor had come out and said, hey, we're going to go mostly online in the fall for all of our campuses, he says, well, we intend to have athletics in 2020. Well, shit, so do we. So it's like, well, I get your whole rah-rah speech, right? So, then you're sitting here trying to battle, like, why are they going back? Why is the state of Montana open? Well, South Carolina, Clemson, they start June 1st. Like, okay, well, but you're not there. You're here, or you're in New York, So I don't, I think it's interesting to find out what's going on, but I think you have to stay regional and you have to stay with the science. So the key is trying to figure out who's got the best science out there, seems like.
That's a good point. I mean, if you're in California, you're not competing with Alabama now. If anything, you're competing against the virus, right? So.
Right. And so, I mean, that's the natural region, the natural knee jerk is, why are they doing that? Okay, well, hold on. I understand that. But we need to talk about that, right? And this goes down line into several different things. So what happens if we come back, everybody's playing, it's 5 weeks into the season, and somebody tests positive in a game, right? So now both those teams are gone for 2 weeks. Let's say it's baseball. So you lose, 8 games. So what are you going to do with the standings? So now you got to come up with a plan that says, okay, we can't just say, okay, you can't compete now for the championship. So now you got to change that a little bit, and so this thing gets, like I said, it's like peeling back an onion, man. When I read the document, thank God it's such a great document, mostly because I stayed out of the way. I mean, we got some smart people involved with this thing. Some of the things you have to have more than one person involved to brainstorm it. For example, I was amending the document. I called one of our doctors and I said, I noticed here that like in our weight room, we have 10 platforms. We're talking about having 10 kids in the weight room at a time where you can clean it. Programs are short, the next group in, but you also had it outside for 10 people only. I thought it was different being outside. It's like, well, that's a good point, and I said, as long as we're spaced, it should be okay. But then you think, okay, well, that's great. and I called it the corridor of activity, right? If you're running straight ahead and each athlete has their own corridor of activity, that's perfect. But how many of us just condition that way? So now you're thinking, so we can have a bunch of athletes out there. I mean, say how wide your soccer field is. It's maybe 50 yards wide, 55 yards wide, 6 feet here and there. Okay, now you can't have them cross. What about practices? So now you have to have enough room out there for people to change direction and have crossing happening. Oh, how are you going to manage that? So now your practice turns into 3 practices instead of 2. Instead of 1. And so this, now you got to figure out why these other schools are doing what they're doing. I'm like, wow, I'm really looking at it, but I'm really relying on the director of the health center who's got 30,000 students in mind. Here's the other thing too. Early on, we talked about doing some hands-on stuff with therapy, and she was all for it because we had some kids coming back from ACL where they needed to now be externally loaded. It wasn't enough for range of motion and body weight. They were going to the next step. She thought it was great, except for the PPE, she's been told, as the other campuses, hold on to that because you may have to donate that to your local first responders. So no, we can't do that. So you're like, oh, yeah. Okay.
We're going to get Keenan to jump in here because we were talking about this again. We're going back to the legal piece. And Keenan, do we get people to actually sign a liability waiver saying, yeah, I'm okay going back, and if I get coronavirus and die, the university or the USA Swimming is not liable? Like, how do we do this?
Yeah, I think that's one component of it, and the second one is I just really wonder how many coaches and athletes are going to finally, just at least in this instance, but hopefully it opens up the door for future evaluation, are going to be receptive to being essentially guinea pigs, right? So there's a lot more we don't know about this disease than we do, particularly in the athletic population. So a couple of things that have been circling around is we're thinking about opening up the Olympic Training Center here in Colorado Springs, and then pools throughout the country, right? Because it's gonna be local and community pools before it's university pools, and so we have some great opportunities. And so what I mean by that is if we look at like the third week, at least in the United States, with the COVID-19, is when we started to have a huge uptick in the African American population. And like for instance, in Chicago, 70% of all COVID-19 cases are African Americans, and 50% of those have been fatal. And then when you look at the athlete population that have self-reported, right? It's been the NBA. The NHL was in full swing at the same time, and I really have not heard of any NHL athlete reporting it, and I've been searching for it. The MLB was in full spring training, and within the last 2 weeks, we've seen an uptick in the Latino communities in the United States. But we didn't see any. I haven't heard any positive cases. In the NFL, it's just all the fat coaches, right? Like, great, Sean Payton got COVID-19. Well, because he falls in that population, he's over 60, hypertension, probably pre-diabetic because of their nutrition, et cetera, right? So I thought of that as like, we just can't be negligent and just be like, because when we turned to the president, right, when he was asked that third, like, why is that? You just got like the usual blah, 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 blah. We have a wall, right? But like when we start to bring these athletes back, I really hope that they're going to be receptive to being essentially like case studies. Like we're going to have to collect biomarkers on you guys beyond just like the COVID. So you get tested for COVID-19, like the human body just doesn't differentiate like, okay, you don't have you have the antigen, you don't have the antigen, but what other factors? Why are subcategories being hit? We keep saying that the athletic population, that age group, that health, they're pretty low risk, but we don't know that. Like there just hasn't been a ton of reported cases. And then you think of the cardiac component. I don't know if any of you guys, your sports medicine staff, has started to bring in the discussions of cardiac screening and the real importance of cardiac screening. And I think that's going to be one of the more, but right now, unless they check yes on their PPEs, we don't really cardiac screen them in most, whether it's the pros or college. So, but we know that 30% of all COVID-19 emergency cases have a cardiac component of it. And how many athletes every year do we hear about sudden death just because they're so fit, and in athletes' world, is get your heart rate up as high as you can to keep it there, so the next day you're more fit. And then just sadly the next day they die. So we're trying, you know, for when we open up back here in Colorado Springs, we've got a controlled environment. So if they want to come back here, because this is one of the very few pools that they can train at, they're going to adhere to those things. But what we're trying to get out in the community world is what exactly these questions that we're all answering as they apply to the NC2A situation is like, we can almost like sterilize the athletic department. I think Fred mentioned, right? Like we could just like, it's like a soup kitchen. We could just like hand out meals as they walk by, right? That way we don't have to have communal eating. In the training center here, we're gonna put thermal cameras into the dining hall, so when they walk in, if they're spiking a fever, we can quickly identify them. But what happens like when they do go home, and we're human beings, right? So like we go home, the kids start to get into 1 to 2 weeks of training, like they're going to want to see their girlfriend or their boyfriend, who's just standard population. Girlfriend, boyfriend is staying at home and grandma moved in because the world shut down. And Johnny athlete has it, but is pretty asymptomatic, makes out with girlfriend goes home, girlfriend gives it to granny turns pretty catastrophic. Those are the things that, like, from a communal standpoint, I hope we're going to be okay with, like I said before, the big brother scenario, so we can just figure out the most safest means for doing this.
You bring up really good points, particularly in terms of like the ethnic differences, but also that really makes me think about even the socioeconomic differences, right? And maybe I'll get Coach Sanchez to jump in. But if you look at swimming, like think of some of the sports that we may return and say, oh, that's a bit safer. Swimming, golf, tennis, right? Are those there's socioeconomic differences? Like, does USA Swimming have a profile of like how many African Americans participate versus other sports? Like there's some interesting stratification there in terms of which sports may suffer less because of the reasons that you've brought up as well. Have you thought about that?
Yeah, that's why I jumped on it, and I was like, well, obviously I can't rely on our country to provide that information. Yeah. So we've got a really fantastic senior sports medicine advisory committee, and so we have a pulmonologist that sits on there. And I texted him right away, and I was like, okay, we got the usual answer, like blah 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 blah. I have a wall. It's Obama's fault, right? Like, what are the real reasons for this is going on? And he sent me just like the first kind of editorial piece from JAMA, Journal of American Medicine. And a lot of it is like, it is socioeconomic. You can't social distance in the projects, right? People are living on top of each other. Our country has failed quality eating, and so that's why they're pre-diabetic. So that's from a general population. But like, that's why I was like, as a sequelae to that, like, why is it only the NBA guys that we're hearing out? And like in the NFL, right, Von Miller, and I can't think of another NFL player that's come public. Certainly, maybe some have, but again, so I'm like, oh, there has to be something to this. Von Miller, I don't think, he doesn't have hypertension, right? It doesn't look like it to me. Kevin Durant doesn't appear to be pre-diabetic, although maybe that's why he tore his Achilles. I've heard that kind of rumor kind of tossed around, like their diet in the locker rooms. But it's a whole other tangent. But so that's why I kind of jumped on it and said we cannot be at the forefront of saying postpone the games as an NGB, looks so good, and then start to open up, and maybe we have 3 training camps throughout the country with our top 10 athletes in each one of them, so 30. You know, arguably our best athlete is an African American, and something bad happening to her, and then we look like, oh, well, we made sure the white people were okay, but not the other different populations. So it's just another thing that's going to add a complication, but it needs to be done, right? Like we don't medically screen everybody this well. I hope not. We still do in some scenarios, but I hope we don't we don't do the same PPE. We don't do the same like forced profile testing the same way for each athlete population. We have to approach it in the same way.
Yeah. Oh, definitely great points. It just further complicates all of this. Coach Sanchez, you've worked with team sport. What are your thoughts on bringing back people in a team sport environment and even some of the stuff that Keenan just said? are some people going to be at higher risk? Like, even like, I haven't looked at the numbers on sickle cell anemia and all of these other things, you know, that people get screened for, but are we worried about certain populations within that team sport environment?
Yeah, I mean, obviously there's so many layers to this. I mean, it's so many layers. And I think what we're getting from this is that leadership is so vital in these pieces right now. I mean, leadership has to be trickled down. There's not an apples to apples comparison. You can't, what works at Clemson is not going to work at Cal State Fullerton. You know what I mean? Like, it's, everyone's spread out differently. The gentleman from Michigan talked about that they have 5 institutions within a certain amount radius that's just so jam-packed in an area. So it's never going to be an apples to apples comparison. My thing is, how can you figure out, because obviously this is going to, you know, the science is always going to be the science, and we have to listen to it. And that's what's been, the people in the right track have really used the science to guide them in the right direction. And it seems like everybody has different people that gives them that science, but how do we centralize that as an NCAA or whatever, you know, NCAA, NAIA, all these intercollegiate athletic sports teams, how do we centralize data in one place? And I think that requires the NCAA or these big branches to step in and provide that, because there are going to be schools that have the resources. There are going to be schools that don't have the resources. And we're going to have to figure out a proper return to play protocol for these people, because it's not going to be an apples to apples, but we can utilize the data to allow us to make informed decisions, I feel. But, you know, I was born in Compton, raised in Watson, Southern California. And I can tell you, people in those areas, man, I have a lot of friends down there that are just not taking this too serious. And they're thinking this crap is a vacation. I'm currently in Oakland, California. And when I go out to the grocery store, there's places where they're just not giving a damn. And it's so unfortunate, because again, that's selfish. It's not whether or not it's going to affect the healthy population, it's whether those people are going to affect those that are in jeopardy of or being more susceptible to getting it. So there's a lot of layers to this. And I feel like the leadership is going to be so important to really have one message that can be used at each institution for their use. So I hope that makes sense.
Yeah, that's a great point around people who already feel disadvantaged and they're like, yeah, whatever, I got other shit to deal with. So, you know, I'm just going to try to, you know, survive, you know, in the way I know how. That's an exceptional point. Ryan Banta, you jumped in late here. You got your hand up, and I don't know if you've been listening to the conversation, but what do you have to say, Ryan?
All right, great. So I know I did drop in late, but I did have a question for the group. Have you guys discussed at all about the studies and research that's coming out now about vitamin D and deficiency and insufficient, and how the people who are, you know, woefully insufficient or deficient are struggling the most and at the highest percentage with this? And has there been any thought amongst the sports therapy folks and people in college athletics about making sure that that's getting taken care of?
I'll open it up. I haven't looked at it specifically. I've seen some of the whatever articles on that, and people have been posting about that, and certain ethnic groups may be disadvantaged in terms of, you know, vitamin D. Rob, do you have any thoughts on that?
I just saw that recently as well. I think, you know, socioeconomically, it comes down to, you know, meals, what you're eating, things like that. I think, fortunately, we're getting, if this is true, fortunately, we're getting to a time of year where, you know, sunshine provides vitamin D as well. So, you know, in conjunction with what we, you know, intake into our body, can we get people outside more? And will that help assist this vitamin D deficiency that maybe occurred during the winter? I mean, I truly don't know. I just saw this literally the other day. But it's a good question, you know. I just wanted to say, Coach Sanchez, what he said before, I agree with him. Excuse me. I think you have to come up with standards, but even if you come up with standards with leadership, as Coach Aleo said before, if we're going to test everybody, those Cal State Northridge have the same budget to buy the PPE and the testing equipment that Alabama does. So even if you come up with these standards, or the school's going to be able to follow those standards due to differences in finances and economics at each school. But I do agree. I think you need some type of leadership and some type of standards. But even then, who knows if we can do it, right? Power Five, I would imagine would be okay because they have that big TV contract. And then obviously, not only a national contract, but conference contract. So I don't know. It's going to be interesting. It's going to be interesting. But back to the vitamin D, I don't know. I haven't looked into it as well.
Keenan, have you heard anything from some of the nutrition?
I think I've seen 3 or 4 kind of anecdotal pieces coming out where again, I don't mean to sound like a politician, where it's like, are they correlative or are they causative? What I hope, again, like what we learned from this is, I don't know if you guys remember, it was like 3, 4, 5, maybe longer. It was basically when the Philadelphia 76ers started getting good and all their guys started having fifth metatarsal fractures. And then the NBA was kind of like, oh wait, like maybe we have all this money, we should be doing like blood chemistry tests on them. And we realized, like, again, African-American population, they're vitamin D insoluble. So the point I'm getting at is hopefully this is just another like change in narrative to be like, make your like healthcare, make your systems professional, or make your systems the very best they can possibly be, so that whether or not vitamin D deficiency is correlated to more susceptibility to COVID-19. Anecdotally, it makes sense, right? Like low vitamin D makes you more susceptible to upper respiratory infections. Vitamin D has a strong correlation to those with upper respiratory abnormalities, whether it be allergies or asthma or vocal cord dysfunction, 3 different pathologies, both attacking the pulmonology system. I just hope that, like, but again, you're right, like, right? Florida State, our guy out in California, right? USC, UCLA, I don't know about Cal Berkeley, but those 2 California schools, the budget's endless, but what are all the other smaller Cal State universities? Like, do they have a budget to run that on their athletes? Does it become kind of a social kind of, like, when we're talking about who pays for everything, like our hospital system's willing to be like, oh, this is a great way to find the answer, because we get our N, we get 500 student athletes that are willing to like have their blood drawn, have their vitamin D levels assessed, and then see like 2 weeks after that, 14 days after, quarantine or throughout the season, who gets COVID-19 correlation to that. Again, I think it's just a great opportunity for high level, like we always talk about sports science and this bullshit term, high performance people. Like you haven't won, whatever. I won't go down that road, Derek, but like here's an opportunity. Like you want to be high performing, have a healthy team, and then we'll get going after that.
That's a really good point, Keenan. This whole idea of let's make everybody as resilient as possible. This is a great sort of, I hate to say it, this is their experimental, process here of like, let's see how we can do. Let's see how good you can do at this process, right? Like, do you want a challenge? Here's a challenge for you. I mean, it's going to be a lot of wait and see and adjusting and managing. Fred, I want you to jump in again, just because you were one of the guys to start us off here. What are your thoughts after hearing all this, and does it change anything that you're going to do?
Oh, absolutely. It changed what I'm going to do. But I want to go back into like the vitamin D talk with certain schools. If they're RO1 institutions, they have a little bit more of an ability to get into that. Wayne State, I know, is one in our area, and it's something that they could definitely jump into, working with either blood or working with heart rate and checking that kind of stuff with those at-risk athletes. I think that's something to definitely jump into. Me as myself as a sickle cell trait individual, like it's something to think of for athletes coming in. Luckily right now we don't have too many. Just knowing our roster off the top of my head, but it's definitely something to think about with athletes from inner city Chicago, Detroit. It's things to think about. Tampa with our Florida athletes, it's something to think about with those guys coming back.
Yeah, definitely. Yeah, I think that the whole vitamin D thing has me thinking too about, just as a sort of a blanket activity, like, hey, let's just do it, see what happens, but just let's cover our ass on that. Ryan, sorry, you had your hand up again. Ryan's probably cooking again. There you go, Ryan.
No, I was dealing with one of my tiny tornadoes at the house. So she was screaming and yelling. Of course, right when I get on this, like a temper tantrum. Anyway, no, I was just going to say that the same thing that Fred was saying. I think it's a cool opportunity actually to be able to probably monitor these athletes on a different level if there's availability and, again, legalities to getting their blood all the time. I don't know if this is still true, but I thought at one point that Baylor had a relationship with Athletigen and they were pulling all their DNA, to kind of figure out their athletes and doing stuff like that. If this is a thing, this might be game changing, not just for COVID, but just in general health for people to pay attention to something that they might not have been thinking about for a really, really long time in terms of just staying healthy, not getting sick, and being a balanced athlete that can heal.
Yeah, I was hoping Coach Chris Roof was going to jump on. Maybe he could have said something about that. But yeah, he's not. I invited him, so he was busy. Let's go back to Robert. Robert at St. John's. Robert, you got any final thoughts after you started us off?
A lot of information to soak in. It seems like this all comes down to money, right? What schools have the money to bring back their athletes, to test, to compete. And for me, it's a concern because I'm going to be exposed, and how do you coach in a weight room and keep social distance? I don't think it's possible. So I'm going to have to either take a risk or retire, and I don't think those are two options though. I don't know the third option.
No, those aren't great options at this point.
No.
Yeah, we all can't be Rob Panarello. Rob, what do you have to say?
About what?
What do you get from all of this? What do you get from all this?
I'm very interested in all this. I find it fascinating, to be honest with you, because I am not at the university setting right now, right? I'm in a private entity, but there are some strong correlations, and that's why I ask the questions I ask, and I'm listening to what's going on here. I think it is just truly, and it will continually be an unknown until we come up with a cure or a preventative measure medically for this pandemic. You see things that are going on in New York. We're a hotbed, so maybe a lot of things happen here before they go across the country. I don't know if that's a true statement or not. That's an assumption. You know what they say about assume. We started with it was just going to be the elderly, and then all of a sudden it affected younger people. Now we're seeing that in children we're having symptoms where changes in blood cells similar to Kawasaki disease is occurring. So this thing is consistently changing and never for the better, right? It's always that, well, you found this out now, which is, concerning. I agree with Rob. I don't think we should say disasters and chaos and the rest of it. We've got enough going on. So, I've thrown a number of things out there just to pick people's brains and get their opinion on it, whether we should quarantine a team for a day or two because they're tested and get the results before the game day. If vitamin D truly turns out to be effective with regards to preventive or part of the process of addressing this disease, then how do we make sure that it's instituted in every training table in an absorbable form? Just things like that. But I agree with Rob from St. John's. I think it's going to come down to money because, I don't know if social distancing is a realization in this young population. Even if you do it in practice, was put up the house party. What happens at the house party? 36 students in a class. Does that close the class? Everybody else registers and they take it online. So many other things are going on. It's just, it's going to be impossible to prevent this from spreading within athletes and teams. I really feel that way. So my thing is, how do you control it? Once this evolves, how does it control it? I asked before, if 5 members of the same team, get the virus? Does that shut the team down and they're prohibited from further league play? Or do you keep going? But what if the snowball's already going downhill and 5 becomes 6 and 7? Are you going to expose that team to the competition? All these things are just, it's easy to come up with thoughts and suggestions. Solutions are the difficult aspect of this. So I just think this is going to continue to evolve, and hopefully we get answers sooner than later. But until we get either a cure for people that get the virus or wind up with a preventative measure, a lot of this is just going to be the best guess based on the facts. And that's probably an oxymoron, right? Guess versus facts. But best guess based on the facts that are presented to us, and the facts appear to be changing as time consistently moves forward.
Yeah. So Keenan, is this kind of like the great experiment of summer of 2020? And, we give people vitamin D, we track that, we social distance as best as possible, even though we know there's going to be leakages. Like, is that what we're doing over the next 3 or 4 months? Is that?
Yeah, just taking notes, I think we did come to some pretty good conclusions as a group today. First and foremost, I think everybody here realizes that from a psychological standpoint, from a societal standpoint, and quite frankly, from a financial standpoint, sports need to come back. I don't think anybody on this Zoom call, and pretty much anybody in the sports industry, doesn't want to get back and watch the athletes train hard, train logically, train intelligently, like a huge open door there. We just don't go by touch points and feel anymore. I think people on the discussion brought up like the acute to chronic workload ratio and load management, all these things that we talk about. We have a wonderful opportunity to do that because we're starting from zero. I think we all are in agreement, a consensus statement that none of us have done this before, so that when we do open it up, just from the pure training standpoint, no one's the expert. There is no like number one NSCA strength coach of the year this year, because we're all doing our very, very best. And not to regurgitate but to reiterate, we've got an opportunity in terms of testing and studying to do this right. But I would say the final conclusion is what we brought up. Like, we just need leadership. I think the sports medicine staffs for every sporting organization, I think the performance staff for every sports organization has some. I mean, it's not like we're just sitting around, to your point, watching, what's it called? The Lion King Man?
Tiger King.
Yeah, it wasn't me. Or episodes of Friends. Like, we've been thinking about this. Like, how do we do right by our athletes and coaches? And so the plans are in place. We just need the leadership. We need executive directors. We need in-house legal, all these things to be like, this is our plan. Please understand there is no correct plan because we've never had to do this, but we've taken into all these different considerations and risks, and we're going to do our best. But don't point fingers when things go wrong, because things will go wrong.
Yeah,
it's inevitable.
Just a quick question. Do you think we have the leadership in place?
Oh, yeah, we do. There's fantastic athletic directors out there. I mean, I think of Ward Manuel at the University of Michigan. I think of Ray Anderson at Arizona State University. Gene Smith at the place down in Columbus. I can't remember the name of that institution. But in terms of, Adam Silver is one of the sharpest individuals in the sporting world. Not selfishly, but factually, the CEO of USA Swimming, Tim Hinchy, is one of the brightest individuals, forward thinking. I mean, he took the lead in saying, hey, we need to postpone this game. So we do have the leadership, and I think there's many of them that are trying to do it. I think we're gonna get that leadership. It's just, I mean, they're getting the facts as well too, right? But for those of you that work in the professional sporting organizations, right, our country leans on you. Right, wrong, or indifferent. In some cases, professional sports do it right. In many cases, they don't do it right, just because they got the players and the money. But we're going to rely a lot on you guys to do this in the right manner.
Yeah, well said. I think this has been an exceptional, just sort of documentation of all the issues and facts and possible directions. So I thank everybody for your contributions. I think it'll help a lot of people just to watch this as well, because I don't know if everybody's thinking the way you guys are thinking. even though, like Keenan said, there's a lot of good leaders. There's a lot of people out there sitting on their hands going, I don't know. So I'm very interested to see how this plays out. And certainly I want to do a follow-up on this with everybody that's here and say, okay, in 3 or 4 weeks, like, has things changed? Are we pointed in the right direction? And what is your organization doing? Because I think, like Rob said and Keenan said, this is an evolution, and it's not, this is what we're going to do and we're sticking to this. It's going to shift and refine all the time. So thank you very much for jumping on. I put this up at the last minute just because I'm like, oh, that's a good topic. So I'm kind of pulling these out of my butt and just running with it. So it seems to be working. So thank you very much, and enjoy the rest of your weekend, and continue to be safe.
Thanks, Derek.
Take care.